Welcome to the show. We often talk about core strength, six packs, you want to have a six pack, fitness hacks. But here's the truth, the real foundation of your health movement and even your confidence is something most people never mention: the pelvic floor. Today we're hearing the tear down, the stigma from I love this term, Vagina Coach. Herself, Kim Vopni, who's been shaking it up the internet by saying that what everyone else is way too shy to talk about. Welcome to the show, Kim.
Thank you. I appreciate you having me.
So, Kim, let's just kick it off here. In your opinion, why is it that we normalize knee braces, dental care, gym memberships, but still treat talking about pelvic floor like it's some taboo thing?
We have to whisper it. Yeah.
Right. What's the real cost of ignoring it? And let's talk about what goes beyond the vagina.
Yeah. Well, many things go beyond the vagina, I guess, but we have this, it's a body part that historically we've never really identified with proper anatomical terms. We usually have used hush, or it's something we don't talk about. It's pushed aside. We're dismissed sometimes. It's not brought up in healthcare appointments. We have media telling us that this is just part of being a woman. So we just sort of accept a lot of things, I think. And then we also have the role that social media has played in increasing awareness about this topic. However, has also, myself and many of others who use proper anatomical terminology, have our posts taken down, have our accounts suspended because we're using inappropriate terms or inappropriate information. And so there's a lot of different things that are contributing to keeping this message in the dark. Thankfully, in the last few years, that I haven't had my account suspended in quite a while. But it still happens to a lot of people. I don't know if I just passed a certain test. I don't know what happened, but it's changing just very, very slowly. But I think a lot of that just historically, it has been a part of the body we just simply don't talk about. And generations in the past have suffered as a result. And part of me using the term Vagina Coach was to say that word, the uncomfortable word that nobody wants to say, so that we can start to open up this conversation and give people power to name it and to talk about it. And also hopefully have that trickle over into the healthcare system, where I think it should also be kind of like a vital sign. If we're asking about constipation and do you leak when you laugh and do you have any painful sex, those are health measures that we should be talking about.
Yeah, I think it's fascinating because what alongside of that taboo conversation was menopause. Mm-hmm. Now we're becoming more aware that there's been virtually zero research on what a woman can do for herself after 40 or 50 and when their hormones are out of balance. But this is a key topic too, because it's not just a sex thing, it's a body function thing that is much more important than most people think. So it's been fascinating. So let me ask you, well, first I want to mention that I think it is fascinating. Are you the originator of what you refer to as the buff muff?
Yes, yeah. That's me.
That is absolutely brilliant.
It's brilliant
marketing. I've been talking about you to patients. I go, wait till you hear this podcast come out. And all I have to say is buff muff, and they go, tell me. The men ask, the women, I think it's fantastic.
It's brilliant.
Right?
Yeah.
Before I ask you about the age-old reference to Kegels, could you just point to that sign behind you and highlight for our viewers?
Keep calm and Kegel on.
I love Kim.
Yeah, that's the term that most people, if they've heard anything about the pelvic floor, it's usually Kegel exercises.
Why is that? Why could that be a problem that people only compartmentalize that particular?
Yeah, it's like, it would be like saying, there's the leg extension is the only way that you can strengthen your legs. Like there's a lot of different ways that we can improve function of our legs and the joints that our legs are associated with, right? It's not just one specific isolated isometric contraction where we're not even moving. So a Kegel exercise, I would like to honor Dr. Kegel, who paid attention to his female patients that were suffering, and he was using biofeedback to help them connect with a group of muscles that we can't see. So different from me going to the mirror and doing, flexing my bicep, or I can see the other muscle groups that I'm training generally. The pelvic floor is inside. We can't see that group of muscles. And because of all of the other different layers we were talking about of taboo, we don't talk about it. It's private, it's hush hush, it's code names. Maybe there has been trauma associated. There's a lot of reasons why there may be disconnect. And so we, first of all, benefit from education to understand that we even have a group of muscles there, that it isn't one, that it even is muscle, skeletal muscle, but it's also multiple different layers of muscles that they have huge, you mentioned the core, really important jobs, with the foundation of the core being one of them. Core control and stability, the pelvic floor is very intimately involved with. So we benefit from that information, but what we historically have received is zero information. And we somewhere maybe along the lines, usually it's showing up when somebody becomes pregnant, somebody, whether it's an aunt or a sister or maybe a healthcare provider, make sure you do your Kegel exercises. And it's this elusive exercise that we might have heard, or somebody maybe gave us a brochure or pamphlet, or maybe told us to do. But the majority of people have never been evaluated to say, you're doing them correctly or incorrectly. And we know from research, Kegels work when they're done correctly, when they're done consistently. We also know from research, most people do them incorrectly because they've never been taught. And sort of where I want to expand and my buff muff approach is that Kegels are usually done, they say do it at every red light, or do it when you're brushing your teeth. And that doesn't train the pelvic floor very robustly, doesn't train it for really a lot of movement. We're not training it dynamically. So we need to incorporate multiple different movements, various planes of movement, supine, standing, seated, sideline, with instability, like all the same training principles we would apply to all the other muscle groups in the body. I believe we would benefit from doing with the pelvic floor as well. So just thinking of, I think I'm doing Kegels correctly is not enough. And they're boring. To sit at every red light also is not, if you sit at a red light, what's the red light? For maybe 10 to 30 seconds. So you might get a few Kegels in there, but the load also is not going to be enough to really, for the pelvic floor to have any need to adapt. We need to get to reach a point of fatigue. We need to, again, have multiple different ways that we're training it. And that's not happening standing, brushing your teeth, or sitting at a red light.
That's like saying, I want to build my biceps, so I'll just lift a dumbbell whenever I have an opportunity to do that. Or,
Right. Yeah. Yeah. Like say 20 times in a day, you might curl your arm and hold it there for a second and put it back down. And then 5 minutes later, you do it again. It's not to say you're not going to get zero benefit, but probably not the benefit you're intending.
What would a exercise session focused on the, that area, that pelvic floor, those pelvic floor, what would that look like? Or what would that, how long would it take?
What's a buff muff workout?
Well, yeah, actually.
Yeah. It's really when you think of any form of exercise, if especially somebody has been a non-exerciser, we don't just throw them in the gym and put them through a really rigorous workout. There's going to be some fundamentals, some foundation building, progressive overload that we want to go through. And the same principles apply with the pelvic floor. First, we have to understand that there is a group of muscles there. We have to can we voluntarily contract and relax that group of muscles? And also appreciate the relationship of the pelvic floor with our breath, with the breathing diaphragm. In an ideal functioning core, when we take a breath in, the diaphragm is, coming out of its dome shape, it's flattening, drawing air in. What should happen below is the abdominals should expand and the pelvic floor should also expand, eccentrically lengthen. When we exhale, the pelvic floor concentrically contracts and lifts. The abdominals naturally draw in, diaphragm goes back up to its dome shape. So this, I always kind of refer to jellyfish. That's a terminology and visualization I use a lot. So the inhales are expanding, allowing air to come in. The exhales are getting the stale air out. There's where our contractions coming in. And when we bring the breath into it, it adds an additional understanding again of our own anatomy and our bodies and function. So when we establish that first, then we can move into now the progressive overload. So I use a term called core breath. That's my term for a Kegel, because I wanted people to understand the pelvic floor is part of the core. I also wanted them to understand that the pelvic floor works in synergy with the diaphragm. So we inhale, we expand the rib cage, expand the belly, expand the pelvic floor. We exhale, and now we add the voluntary activation, which is, people think that's the only part of a Kegel, is just the contract and lift. We add that voluntary activation on the exhalation, and then we go through breath cycles to pattern that inhale to release, exhale to engage, inhale to expand or release, and exhale to engage. Once they've patterned that, now we want to say, okay, let's start to layer that into a pelvic tilt or a bridge. To start out with, usually I'm starting in a supine position. That's when most people will feel, they'll feel more within their pelvic floor, I would say. Once we get upright against gravity, so in a seated position or in a standing position, say with a squat or a lunge, there's a lot of other things that are happening. The pelvic floor is working to stabilize us. We may not feel so much of that voluntary activation and relaxation as we would in a supine position. So I start there usually with most people. Then we go into more upright in a tall kneel or a seated. Then we get up into standing. Then we do a little bit more of a forward or a rear lunge as opposed to just a stationary lunge. But you can bring the core breath into a bicep curl, a push-up, a one-arm row. Like, we can bring it into many different movements, not saying we have to, but we can. And especially from a retraining perspective, really the Buff Muff method is taking people most of the people are dealing with an issue, and we are retraining the pelvic floor to react at the right time with the right amount of force for that task at hand, whatever exercise it is that we're doing, so that we better manage pressure, so that we have the capacity for the pelvic floor to manage the movement and the dynamics of whatever it is that we're doing. Then we can start to add load in the way of, we add resistance, we add more sets, we add more reps, we maybe add power, so explosive movement with jumps, because most people are leaking or are symptomatic in their pelvic floor, not when they're standing brushing their teeth, not when they're lying down on their back. It's usually when they are lifting a child, pushing a heavy door open, standing up from a chair. So we need to make sure that we are training the pelvic floor as we would with any other thing. We train with the principle of specificity rather than just 3 sets of 10-second holds, which is, if you look in the literature, that's the gold standard of Kegel exercises.
What, for the listeners and viewers, what are symptoms of a fluff muff? I made that up. Well, of a weak muff, a weak one. What are, I remember actually like 35 years ago, a patient came to me who was a long distance runner, and she would have leakage in the 5th mile of a marathon and would have to find a bathroom somewhere, or it would just go down her leg. So that's just an obvious one. And I had no idea what was wrong back then. What are other symptoms? And for men as well.
Yeah, that's a great point to bring up. Men do also have a pelvic floor. And now, male-female anatomy, the male bony scaffolding of a pelvis is different, narrower, a little bit higher. There's no vagina, so no vaginal opening. There's no uterus. There's no menstrual cycle, the hormonal fluctuations, no pregnancy, no childbirth. Those are, and menopause, as you mentioned earlier, those are things that definitely increase the likelihood of pelvic floor dysfunction. But men are certainly not immune to pelvic pain, incontinence, constipation can be tied to the pelvic floor as well. So from a female perspective, which is the population that I work with primarily, the term weak is also something that we need to clarify a little, because we interpret weak as, you said, fluff or lax. And that can be true. It can also be true that somebody has excess tension that is contributing to weakness. So a tight pelvic floor is also a weak pelvic floor. And if that tight pelvic floor followed the guidance of you need to do more Kegels, and their interpretation of Kegels is squeeze and hold for 10 seconds and do that multiple times a day, not knowing they need to also release and probably would benefit from more release, then they could be adding more tension and potentially even having worse symptoms. So pelvic floor dysfunction can be laxity. It can be excess tension. So poor blood flow, poor circulation, poor reaction time, pain, and lack of the muscles can't do their jobs when they are held in a chronically shortened position. Incontinence, we can have stress urinary incontinence. So that can be laughing, coughing, sneezing, jumping, some sort of exertion where the pressure that's created, intra-abdominal pressure, is more than what the pelvic floor can manage. Either it can't react quickly enough or it doesn't generate enough force to close off the opening. So a little bit of urine or gas or stool can leak out. Urge incontinence or urgency. Urgency is where the person may not leak, but they all of a sudden a trigger will happen. They hear running water. They just think about a bathroom. They put a key in the front door when they're coming home, and all of a sudden their bladder gets all excited and they feel like they can't make it. And sometimes they don't make it to the bathroom in time. So that's urgency. If they do actually have a release of urine or gas or stool, that would be urge incontinence. Then we have overactive bladder, which there is a medical condition called overactive bladder, and there would need to be some extensive testing that somebody goes through to determine, is it truly an overactive bladder, or has this person just labeled themselves as having an overactive bladder because they go to the bathroom in time? And often it's the people who are afraid of leaking or afraid of having the urges who go to the bathroom preemptively. They go just in case. So now then they've created this, they're training the bladder to signal before it's actually empty. So now they're dealing with overactivity or frequency. The people who say, well, I have to, plan my whole day around, is there going to be a bathroom close by? And then we have, as I mentioned, anal incontinence can happen as well. So gas or stool can leak out. So that's kind of I would say the incontinence bucket. And then we have a prolapse bucket. Prolapse being when the bladder, the uterus, the rectum, the intestines in some case can move out of their proper anatomical position and bulge into or descend into the vagina. And if you look statistically, prolapse is more common than incontinence, yet we know about incontinence. Not very many people have ever heard about pelvic organ prolapse until they receive a diagnosis. So 50% of women who have given birth have some degree of prolapse. And it's important to note that people who have never been pregnant or given birth can also experience prolapse. So it's not just people who've given birth. However, it's a well-established risk factor, pregnancy and childbirth. And that is the one, prolapse is the one that I find is the hardest for people to deal with. That's the one that really halts people in their tracks, partly because the symptoms are bothersome for if you have symptoms. Sometimes you don't early stage, but also the messaging that is given to people who receive that diagnosis, especially if the diagnosis comes from the medical community. I don't want to bash the medical community. We need them. But first line of defense, they're not necessarily are in our best interest. So usually they're told not to lift anything over 10 pounds. You can't run anymore. You can't jump anymore. And that's mental health for a lot of people. That's our overall health and wellness is exercise, especially now that menopause population where everybody in there who's talking about menopause now is saying lift heavy shit and jump. We have to pay attention to our bones. So now we have this population of people with prolapse saying, well, I was told that I can't do that. So what do I do? So we have the prolapse group, and then we also would have a pelvic pain group. And that could be low back pain, pubic joint pain, tailbone pain, painful intercourse, vulvodynia, so pain in and around the vulva, vestibulodynia, pain right at sort of the entrance or the vestibule. So those are kind of, I would say, the three main buckets from a pelvic floor dysfunction perspective.
Well, look, Terry, before you ask, I would just want to have the audience really understand or get a feel for what Kim's talking about. When how do you know if you're flexing the pelvic floor?
a lot of people have no idea, and they might think that they're doing it correctly because they say, well, people will read, it's the muscles that you use to stop the flow of urine.
That's right. Yeah.
Right? So people will then sit on the toilet and they'll try, and some of them may do it correctly. Sidebar, do not practice your pelvic floor exercise on the toilet. You can use that as a test every now and then to see, can I stop the flow of urine? But you should not be practicing your pelvic floor muscle training sitting on a toilet. That will disrupt the messaging and potentially contribute to incomplete emptying and infection. So don't do that. But the other way that people will think they're doing a Kegel or a voluntary activation is squeezing the inner thighs, squeezing the glutes, and sometimes even holding their breath and bearing down. So seeing somebody who can help you evaluate if you are doing it correctly, my gold standard would be a pelvic floor physical therapist. But you can also use your own biofeedback, which is your fingers. And you could insert 1 or 2 fingers into your vagina. First of all, the information about, can you accommodate that without pain? And because there are people who that would not even be accessible. But can you insert 1, potentially 2 fingers? And then if you were to use some visualization, so cues that I use for people, imagine sipping a smoothie through a straw with your vagina, or imagine picking up a blueberry with your vagina and your anus. So if you think about that, if you can inhale, and then as you exhale, can you think about picking up a blueberry with your vagina and your anus? What you should feel is as you're picking the blueberry up, there's a gentle hug of your fingers and potentially even a little bit of a draw up. The pelvic floor has a role of organ support as well as closing openings. People think of Kegels again as just squeezing. We don't think of the lift. So we do want to have an element of that hug around the fingers, but also almost feel like we can draw the fingers upwards. That would be the lift. That would be important as well.
So that's the vaginal walls, really. The
effect of the pelvic floor on the walls of the vagina. Yeah.
Got it.
I do got to inject, before we get down too much time, we've been talking buff muffs and fingers and vaginas and all that. There's guys out there that I don't want them to tune out. And you've been very bold about talking about, and we mentioned it just briefly about it's a narrow wall and all that. I've had a lot of men recently with prostate cancer that have had prostatectomies and they can't control their urine and they've got leakage. And I started referring them to a pelvic floor specialist when their urologist wouldn't do it. They just said, here, take medication. So for the men listening, I want to get them engaged. Can we just spend a few minutes of talking about and getting men, because I don't want men to tune out going, well, I don't have a vagina, I don't have a buff muff, so this show is not for me. There's a lot of men, 1 out of 5 to 1 out of 4 men will get prostate cancer. And there's a lot of pelvic problems when it comes to that. Can you just elaborate on for the men and what are some of the top 3 things that they may be feeling that they will never associate with the pelvic floor, that they need to stop and pay attention to that?
Although, Terry, wait a minute. The men are going to still listen because they want a woman with a buff muff.
Well, I know, but you know what I'm talking about.
That's true. Like they for the men listening, many of them will have women in their lives, and potentially, so things like if the person that you typically are having sexual relations with is they don't want to anymore, or they're telling you that it hurts, or they have trouble achieving orgasm, those could be some reasons. So still be paying attention to the conversation around the female. From a male perspective, you're right. The prostate issues would be a major contributor. So a lot of times they don't even think about pelvic floor, again, same as women, until there's an issue. And the biggest contributor for men would be prostate issues. Doesn't mean that other things can't come along the way. It doesn't have to just be prostate related. But painful ejaculation, inability to ejaculate, premature ejaculation could be contributing factors. Constipation, low back pain, or any pain within the joints within the pelvis can all be tied into the pelvic floor. And then, of course, the prostate side of things as well. So radiation, if somebody is having radiation as opposed to removal, greatly influences, but also hip replacements are another thing that is very closely tied to the pelvic floor, and the type of hip replacement. So anterior, lateral, posterior, in terms of the type of hip replacement surgery you have. Anterior is not performed as often. It is the more favorable one in terms of preserving the pelvic floor. The posterior approach will cut through, and especially one particular muscle that is, some people don't necessarily consider it a pelvic floor muscle, called the obturator internus, which is more of a hip complex or hip muscle, but is right in there with the pelvic floor and will become, is very greatly negatively, I would say, influenced by a hip replacement surgery. But even leading up to needing a hip replacement surgery, the compensations of movement, the pain that you're dealing with, all can influence the pelvic floor as well.
I don't think I've ever heard of people talking about hip replacement and then pay attention to the pelvic floor. So thank you for that. That was, and, and especially for staying even on the guys stuff, I love chiropractors, PTs, even MDs. When somebody comes up with constipation, I bet very few have been recommending pelvic floor exercises. So, it's something that we have to definitely pay attention to. The other thing you mentioned, you keep mentioning leakage, but you have these CrossFit games, you have these strongman, Spartan stuff, and leakage when they're really pushing hard. Oh, that's just part of training. That's just part of the game. And that may be actually a red flag. Can you elaborate of some stuff that these people need to pay attention to if they're leaking that is not considered normal when you lift something really heavy? And how would you counsel that patient that would walk in to see you?
There was a video, it's probably maybe even almost 10 years ago now, when CrossFit was sort of really emerging and becoming very popular. And there was a video that was filmed at one of the games, and it was this gentleman going around and basically highlighting women who were wiping up pee on the floor and laughing about it. And the general consensus in this little clip was that that's just what it takes to be the fittest woman in the world or the strongest woman in the world. And they were just sort of accepting it. And all of us in the pelvic floor space were thinking, that's not the message that we need to be sending. And if you're leaking urine, that is a bodily, we should be able to maintain and we should be able to be continent. If you are doing an activity where you are leaking urine, that is a signal your body is sending you saying, something about this is more than I can currently manage. That doesn't mean CrossFit is bad. It doesn't mean that particular exercise is bad or good for the pelvic floor, but that person's current capacity to manage that load in that moment is such that the pelvic floor is failing. So we need to pay attention to that. Otherwise, if we continue to do it, that we're not helping the situation. So somebody who is a CrossFitter or leaking when they run, or doesn't matter what the activity is, my counsel is we need to not label this as a bad or good exercise for the pelvic floor, but we need to take that message and say, all right, let's take a step back. Something in this system is not connected right now. The load might be too strong, and maybe it's the speed at which you're doing it. Maybe it's the time of day you're doing it. Maybe it's the time within your menstrual cycle you're doing it. Maybe it's the weight. Like, there's so many different variables. So let's take a step back and retrain that system, progressively load like we would anything else, so that you can manage that. And also look within the moment. What is your current breath strategy? What is the load? How many reps are you doing? Paying attention to menstrual cycle. Have you pooped that day? All the different things we would look at for any other training modality. Not many people would look at constipation. Have you pooped? But if you haven't pooped, there's more pressure on the bladder. There's less space in there. You're not going to feel as good. You're going to feel cranky pated. And often that is going to contribute to more symptoms. So we need to get all of that dialed in so that we can exercise and do all the things that we want to do without the leaking. But the leaking is a message. It's not something that should just be ignored or considered normal.
What do you hear about when women have a party for their kids, and they have the bouncy house, or they have the trampoline, and and you see the moms jumping, and all of a sudden they start giggling and they grab their crotch because they start leaking when they bounce on a trampoline. Is that a sign of that? Obviously, that's a sign that their pelvic floor is weak. And that's something they need to pay. But most women just laugh, going, "Oh, I have kids, and I just can't bounce on a trampoline." They should be able to bounce on a trampoline, shouldn't they?
Most people, yes. That there are going to be certain situations. There are some specific vaginal birth injuries where that person may have kind of lifelong struggles. So there's something called a levator avulsion, where part of the pelvic floor can pull away from the bony attachments. And historically, this has been a non-repairable injury. There are a few surgeons now who are starting to introduce some new techniques that potentially this will become something we could help. But historically, it's been it's a debilitating, very, very challenging injury to navigate. And 18 to 30% of vaginal births have some form of avulsion. Again, why aren't we screening for this?
Right.
So yes, generally we should be able to do all the things that we want to do. However, kind of coming back to where we started, where we've never been given any information about this at all. And usually it's not until there is a problem that we go and seek help. And historically we look at a period of about 6.5 to 7 years before women actually go get help, because they think it's normal, because they're embarrassed, because they don't want to embarrass their care provider, because they're too busy, because, all the things we could add up on the list. And they then go usually to their primary care doctor. And within the, at least North American medical system, we have very short periods of time. That doctor's job is to rule out any, really major life-threatening, or they would refer it on to a specialist, or they might say, do your Kegels, or they might say, try this overactive bladder medication if somebody was leaking. And there's really, that is not a root cause investigation. There are so many things that we need to really be looking at. Not saying that sometimes the person needs surgery, not saying that sometimes somebody might benefit from a medication, but that should never be our first line of defense. And so back to the trampoline person, women have just accepted it.
Right.
Oh, I've just had kids. That's what happens. That's happened to my mom. It is. And or I've had a bladder lift. Oh, but it failed. And, surgery is offered very quickly to people. And usually people take it because they say, yeah, I just want this done. But nobody is counseling them on now. What I say, after surgery, you need pelvic floor muscle training even more, because now you have scar tissue. The landscape has changed. And if you want to maintain that surgery, you need to work. But we just haven't been counseled or given any information about the need to do pelvic floor muscle training. I always equate it to the dentist. Like, from a very young age, the PR from the dentist was great. Like, they gave us these pink pills, you chew them, you see highlights all the plaque, and we're like, oh my gosh. And so they say, you have to brush every day twice, and you have to floss, and you come and see us once or twice a year. And we're like, and I've been doing that my whole life. And I go to the dentist even if I don't have a toothache or any issues, I go. If we had that same PR for the pelvic floor early in life, where we were explained the importance, how important for continence, for sexual function, for core stability, our posture, our balance, organ support. If we were explained that early on and then told, we have pelvic floor physical therapists, these are the exercises that you would benefit from doing. Here's some signs that things are not great, so you should go seek some help right away. Here's who you go see. Like, that would change the trajectory of women's health significantly.
Well, I think it changed the health of men and women. We're focused on that women, but I think both, because you see these commercials where people are running to the bathroom, and the commercial is all about, do you have to plan, like you said earlier, your vacation around your bathrooms? And if people only thought about, wow, if I actually trained my pelvic floor as much as I trained the rest of me. The other question I have, do you ever see that constipation causes weakness of the pelvic floor, or does pelvic floor weakness causes constipation?
Both. So, and it's usually the tightness. So the inability of the pelvic floor muscles to relax appropriately to eliminate, whether it's urine or stool, but in this case, constipation from a feces perspective. When we sit down to void, the pelvic floor is ideally relaxing so that either the bladder or the rectum is contracting to move waste out. And if we are sitting down without that muscle group, the pelvic floor relaxing, then the efficacy of that elimination will be hindered, whether it won't come out at all or it won't come out completely, or there's straining. And that constant straining is also contributing to excess pressure on the pelvic floor and the nerves as well. So it can be, people can have tightness in the pelvic floor, which again, tight is weak. And that is what's contributing to constipation. But we can also have people that are constipated for another reason that then end up creating pelvic floor dysfunction as a result. And with constipation, usually it's like, drink more water, eat more fiber, try this supplement. Again, all of those can be helpful if it is kind of a gut health or motility or fiber hydration problem. But if none of the other things are working, we have to look at the pelvic floor as well.
Kim, you've used the term poophoria in some of your literature, and I found it very funny because I actually, not only do I rarely ever, I don't think I've ever heard that. Would you love to explain what poophoria is?
Poophoria, yeah. So euphoria, poophoria. It when we have a bowel movement, it should feel almost orgasmic. Like it should feel really great, like a sense of relief, and it should, we should sit down and within a few seconds, it's one and done. It's out. Two and done, I guess. Number 2. But we should have this sense of euphoria after we have a bowel movement, ideally. And so I just did a play on words like I like to do, and we should all experience poophoria, or people call it a poogasm sometimes too. But we just, like, again, it should be.
That's great.
It should be vital signs. So many people are constipated. And they are throwing fiber supplements in there, which again might help. But if they're not drinking enough water, which usually women with pelvic floor dysfunction are not drinking enough water because they think, well, if I'm not drinking, then I won't have the urge, or then I won't leak. That's not true, but that's their thinking. So then they start taking more and more fiber, and they just create this block of cement, and now they have to strain more. And when you're not pooping well, you will have more urgency, you will have more frequency, and you're going to be straining, which is going to be damaging to your pelvic floor as well. So anytime I'm working with somebody, hydration and constipation are always the first 2 things that we address, because so often they aren't pooping well and they aren't well hydrated because they're trying to cope with these symptoms of prolapse and incontinence. And again, no one's ever provided education about why you need to drink water and why drinking more will actually help your symptoms. If we're dehydrated, our urine becomes more concentrated. So the urine will irritate the bladder and want to get out more frequently, more urgently. And also, again, that the constipation with the full rectum is going to apply pressure against the bladder and make you feel like you need to go more often as well.
Hey, Spencer, I can't wait to someday meet her husband, because your vocabulary is hilarious, and how you talk about things. The dinner conversations must be fantastic.
Yes, my husband's totally fine with it all. Not everybody in my family appreciates our dinner conversation, but my kids, I will say my kids who are they're adults now, but when they were younger and first starting on social media, of course, I was following them, and they were like, "Mom, why can't you just have a ghost account? And why do you have to don't like anything and don't comment on anything?" And so they were quite embarrassed. And I remember one of them said, why can't you be a boob coach? And he somehow thought that would be less embarrassing. But anyway, they're fine with it now, and they're very well educated. And
I can imagine their friends. Hey, who's the buff muff that keeps following you?
Yeah.
Why do you have the Vagina Coach following you if you're a boy?
Yeah.
I love it. It's funny. You have a great imagination and creativity, but with that, I also have these visual perspectives of a vagina with flexing, and you having a whistle, and you just down at the vagina level going, "Come on, squeeze one more time."
Well, if you go back about 2 months or so, I've got a video. That exact video is on my social media.
Oh my God.
It's, you know, it's a topic that is not easy to discuss. And yes, I'm the Vagina Coach. I'm very much trying to promote proper anatomical terminology and that it's not taboo. However, we need to have some fun to lighten the load
Absolutely.
of a very heavy subject as well. And so I like to bring a little bit of humor in there because we have to laugh a little without leaking.
No, exactly. I always say we have 2 orifices, and that's the only way. That's what God made, so we can look things up, or 3 orifices, and it's not. Why do we make it such a big deal? But you take it to the next level of comfort and fun and all that to get people that take an embarrassing situation and realize you're just normal, but we can fix it, and I think that's beautiful.
Yeah, providing some hope to people, because it is very lonely and isolating, and they think they're the only ones. They think they're broken, and they, you know, if they have surgery and it fails, they feel even more broken. If they take a medication, it's not working, they feel they're doing something wrong, and they just haven't been given the right tools or care provider yet. And really, my whole mission is to get this information out so people have a better understanding of themselves, that they can feel empowered and can advocate for themselves also. And so they realize this is something that they have such they play such a vital role in controlling it. And if they pay attention, then really their life can change so much for the better.
Hey, Spence, I just got one question. You keep mentioning physical therapists. Are they the only ones that are licensed to do pelvic floor, or are there other chiropractors?
Occupational therapists are now starting. So somebody who has taken the courses and then passed the testing and gone through the licensing procedure, it can't, like, I couldn't do it. I am not an internal therapist, so I can't take that. But somebody like a chiropractor potentially could, a massage therapist potentially could. But occupational therapists and physical therapists right now are the 2 main bodies who take the training and then become licensed to do the internal evaluation and treatment.
So in other words, you know, if you have your certification in strength and conditioning, that's not going to fly.
No, you have to be some sort of a licensed practitioner to then become licensed to do internal evaluation.
That's fantastic. No, that's really great. So with that said, you know, there's, you know, all the influencers out there, they're all pushing, you know, products to fix this and fix that. And I think there's things called like pelvic wands and weight, smart trainers. You know, how do you separate fads from the real tools that work? Do you share that with people?
Yeah, I get asked about gadgets and tools and devices all the time because, again, and you know, companies take a bit of slack because they're marketing to women for you know, a very sensitive topic. And I don't bash the companies, because there are a lot of really valuable technologies, products that are out on the market, and we deserve to know them. Before people, though, invest in a device of some sort, I would always say invest your money first into a pelvic floor physical therapist, even if you go for one session, to really understand the needs of your pelvic floor, what your current pelvic floor situation is. Do you tend to be on the overactive side? Do you tend to be on the lax side? Is there a little bit of an imbalance? Do you have any organ prolapse? Do you present differently? Well, most everybody does, but do your muscles work differently in being assessed in a supine position versus a standing position? When is it what activity is it that is most problematic? Do you still have a menstrual cycle? Are you post-menopause? Are you using vaginal estrogen? Like, there's lots of other things that we can look at that a pelvic floor PT could discuss with you that could potentially be what moves the needle for you before you go and invest in a gadget. That, again, if the gadgets can play a role, but if the user is not educated in how to use that gadget appropriately, it will probably just be another thing that sits in your cosmetic drawer in your bathroom because it's not being used, right? Yeah. So I like Kegel weights as a progression. I like the biofeedback trainers, so like the PeriFit. If that's something that, if you've had an evaluation from a PT and they have said that you would benefit from some isolated pelvic floor muscle training initially, I think those are great. But again, that doesn't train the pelvic floor upright against gravity. That's usually done when you're lying in your bed with the biofeedback trainers. Then the other one is the Kegel chairs. So there's many different companies now and many different med spas and even some pelvic floor PTs who are bringing in these Kegel chairs into their practice, where the woman would sit fully clothed, or the man, the person would sit fully clothed on this chair. And there's basically electric impulses basically that are sent into the pelvic floor to the marketing is, we do 11 to 13,000 Kegels for you, which again sounds glorious. Great. I can outsource the work. And I think I know there is populations that can benefit from that. Spinal cord injuries, nerve damage, mobility limited populations. But it's an expensive outsource. It doesn't cure. It's something you would need to maintain, and sometimes can make the situation worse for people. So again, rather than throwing your money to a gadget, come to a PT first, get an understanding of your pelvic floor, do the work of addressing a constipation, address your dehydration, pay attention to your posture. Do you need vaginal estrogen? Would a pessary possibly help you? Are you doing your consistent pelvic floor muscle training dynamically? And once all those have been done for, say, 3 to 6 months, and the person still isn't experiencing the support they need, now let's go look at what other adjunct therapies we could try. But I would never, again, say that would be a first line of defense.
Kim, let me backpedal for just a minute, and I have a few questions about this topic. Did you say earlier Kegel weights?
Mm-hmm. The Kegel weight. So then you're really getting a buff.
Yeah.
So we can insert. There are some products that are made with crystal or stone, and there are some that are made with silicone. And these are devices that would be inserted into the vagina that are weighted. And usually many of them come in a set. So they start with a lighter weight and they would progress up to a heavier weight. It could be anywhere between 3 to 6 weights within the set. And they would be put inside, and they act like picking up a dumbbell. It's resistance. So it's not where I would start somebody. It's something that they could potentially progress to if they have the awareness and the capacity to contract and relax their pelvic floor appropriately. But many people, 50 Shades of Grey, when that book and that movie came out, there was Kegel balls that became very popular because they were talked about in this book. And a lot of people were buying them thinking it was going to be this miraculous fix to their pelvic floor. And sure, many people could potentially benefit, but there are also some people who don't yet have the capacity to hold something weighted in their vagina. And sometimes the instruction is put it in and hold it and clean your house or have a shower. And I prefer it to be more like put it in and now do some active voluntary, activation, relaxation, potentially hold the little tail part that's outside the body, pull that gently and try to resist that. Like that's more to me functional weighted training for the pelvic floor. There's another one that the portion that goes inside the vagina has a long tail outside, and the weight is actually outside the body. And so you would stand and that weight moves again. So you kind of have to, it's like a wobble board almost. You have to navigate the changing, which I think, brilliant, innovative, not where I would start somebody, but I think that there absolutely is a role for Kegel weights, biofeedback trainers, the Kegel chair potentially for some. It's just the way that it's presented is that it is, I need that device and that's going to fix my problem. And then I won't have to do the work. We're very much a society now that we like to outsource as much as we possibly can to something else so that we don't have to do it. And I always refer to the movie WALL-E, the kids movie. And it's just this brilliant, uncomfortably accurate foreshadowing of our human race. And the more we outsource, like the less we do, the less we can do. And specific to the pelvic floor, we have to get that foundation working well and able to manage all the things that we do.
I would like to make a comment about what has been an age-old device that people used to use they made it into a suitcase with electrodes you put on your abdominals, and you sit back in a lounge chair and it flexes, and they say, oh, you'll get a six-pack abs. That's the same approach that some of these companies use to strengthen the pelvic floor muscles, which it doesn't make sense. Yeah, you're getting something else to do the job, and that's not.
You know what? To walk a fine line. We've heard of what you're talking about, these Kegel balls. We've heard them referred to as like Benoit balls, and they're designed for increasing sexual function. And it's always been marketing as a sexual device. I've never heard of it being marketed for pelvic floor. So a lot of this stuff that's business wise that they threw in and cause these, Asian techniques and all this stuff for vaginal strength, it's actually a pelvic floor exercise. Is that what you're saying?
Yeah. And when we have an optimally functioning pelvic floor, our sexual response will be greater as well. So when we have, like, you're right, a lot of the Benoit balls or the Kegel balls were, and still are, many of them are marketed for sexual pleasure. So some people many of them have, they're a ball with another ball inside. So there's almost like a ball inside that rattles. And when that's inserted, the rattling it's helping with blood flow circulation, but also for some may contribute to pleasurable sensations. But also it's kind of like vibration training where there's more muscle that comes in to navigate that additional movement. And there are some that are marketed, could be the exact same product to a sexual group of customers, sexual health and wellness. And then there's another that's pelvic health and wellness. Really, they can be used interchangeably for similar things. But ultimately, if you are optimizing the function of your pelvic floor, and I'm not just saying strengthen your pelvic floor, but if you have a good balance between effort and ease, you can contract, you can relax, you have good blood flow, you have good circulation, you have muscles that are reacting appropriately, that will then enhance sexual wellness as well.
I can see all these men now getting ready to go shopping for, honey, this is good for your pelvic floor, Well,
So is a pelvic floor physical therapist.
Right.
Yeah. But I got to tell you, you have shared a realization that I never realized. I'm 64, and I recall experiencing intercourse, and after the orgasm, the woman will flex the muscles that I never realized were the pelvic floor muscles. And I actually made a joke about, well, look, you just squeezed me out of house and home. That was, and it's actually quite impressive, the strength that some have with those muscles.
Well, and an orgasm is like, that's a really great pelvic floor strengthening or pelvic floor, because you are getting involuntary contract and relax. So it's kind of like a bunch of different involuntary Kegels done. So kind of like what those chairs are trying to do. So have more orgasm, have more sex. And that's a good way to strengthen your pelvic floor as well.
Well, then we need to, start helping out our women in our life by just helping their pelvic floor, because we're just givers.
Well, and also the way that you can help as well, if you have women in your life, is so I talked about fingers being inserted from being a biofeedback perspective, but a penis could be inserted, just like the PeriFit is a biofeedback device. So if you have a partner with a penis, the penis can be inserted, and that can also be, can you feel me hugging your penis? Can you feel like I'm drawing it up a little? Can you feel like I'm letting it go? So it can be like a little partner training session as well.
I am all over that. Thank you very much. We make it clinical. Come on.
Yeah, it's all clinical. It's all for better health. Yeah, for sure. Yeah.
I'm going to walk into the bedroom with a whistle and all right.
Clipboard.
Let's do it, right?
Yeah.
This is Kim. Kim told us this is what we need to do. Kim, let me ask you about menopause, childbirth, high intensity sports, even long hours of sitting at a desk. All that stress that pelvic floor, experiences in different aspects. I mean, if you had to design if you could just tell the listening, viewing audience maybe a 10-minute daily routine, what would that look like for all life ages? That even the youngsters can start now.
Yeah, I mentioned constipation, hydration always at first. So you want to make sure you're drinking 2 to 3 liters of water a day at least. You want to make sure that you're eating an appropriate level of fiber for you. So we have recommendations of fiber, but people will react differently. So you need to kind of do a bit of trial and error to see what is the appropriate level and balance between soluble and insoluble fiber for you. So you're consuming a diversity of foods, gut health friendly, but also that promote good bowel movement so that you have at least one Bristol stool chart number 4 poop every single day and you experience your poophoria. And then some level of throughout the day, an awareness of your posture, whether you are sitting, whether you are standing, what it is that you're doing. Ideally, you're not sitting or holding yourself in non-optimal positions for a very long period of time. Having the pelvis in a posterior tilt, so where the tailbone would be more underneath you, so to speak, I'm not saying that's a bad position, but if that's how you sit all day, or if that's how you are standing all day, that's not going to put your pelvic floor in a favorable position to manage intra-abdominal pressure and do all the things that it needs to do. So moving in a variety of ways, taking breaks from seated if you happen to be seated, take breaks from standing if you happen to be standing, but optimizing your posture throughout those movements as well. Again, not saying you have to be in neutral pelvis all day long, but just being aware of if you have these holding patterns that are maybe not favorable. Do some form of pelvic floor muscle training. So that could be a buff muff workout. That could be, maybe it is a Kegel weight practice. There's another technique I do called hypopressives. Hypo means low, pressive pressure. So these are generally postures or poses you get in that don't really, they're not huge increasers of intra-abdominal pressure. And then there's a breath practice that we do within that. And that's really helpful for pelvic floor dysfunction, especially pelvic organ prolapse. Can be helpful for constipation, incontinence as well, even people with pelvic pain. So some form of pelvic floor attention, whether that has been being brought into your existing workout or it's its own little, pelvic floor routine. So every morning I do a 20-minute hypopressive practice with about 5 minutes of sort of buff muff style, like a pelvic tilts and bridges with the core breath that I was talking about earlier. But I also do some sort of I do resistance training 3 to 4 times a week, and I will often be bringing my pelvic floor, the core breath, into certain movements within my resistance training workout as well. And that's, and then if you happen to have sex that day, then, hopefully you're enjoying sex. If you are post-menopause, vaginal moisturizer, vaginal estrogen, and lubricant for sexual activity. And sexual activity could be with or without a partner. It could be with or without a device. Doesn't just have to be penis and vagina sex. And even if you're not sexually active just by yourself, you would still benefit, and I consider it to be essential post-menopause for the rest of your life to use vaginal estrogen.
Nice. Terry, tell the truth. Have you flexed your pelvic floor during this conversation at all?
Probably 3/4 of this whole conversation.
Yeah. Oh, I am so pumped up right now. I'm just...
Well, it's good because I didn't notice. Like if you were doing this,
yeah,
that would be great. So
I don't know if I'd use the word pumped up, but I am doing flexing.
I wanted to change that after it came out of my mouth.
And that would be so. Coming back to the male population, I talked about one couple cues for women. So pick up a blueberry with your vagina and your anus, sip a smoothie through a straw. For men, it's the principles of posture, breath, alignment, all that stuff is the same. Cueing would be different. So for men, the one could be making your penis dance. One could be imagine walking into a cold lake and there's, the retraction of the scrotum. The one that was researched to be the most effective cue for men was shorten the penis. And that was interpreted as, or more people preferred pull the turtle into the shell. So that would be the cue that was the best for men in terms of activating their pelvic floor.
Well, I think that's a lot. I think that's a lot better than trying to pick up a blueberry with my penis. So I'm
you can pick it up with your anus.
Oh yeah, but so I'm glad you gave us some other things to think about other than trying to squat over a blueberry bush and.
And that whole concept of the turtle retracting, I just think of that Seinfeld episode with shrinkage, and not the most favorable image. But
well, it gives a new meaning to cold plunges. Because I think that just will do the pelvic floor and everything all. Just jump in the cold plunge and you're good.
Yes, yeah. And when you're in a cold plunge and you're cold, there's going to be restriction, and a lot of people will, especially women, will notice they have an increase in they can't control their pelvic floor as well when they are really cold, and that could be cold weather. It could be in a cold plunge, getting out of a pool, because we're tense. And again, tension is not. We think of, we want a tight pelvic floor, we want a tight vagina, but it's tension that is often contributing to the weakness. So when we can let go of that.
On that note, is a cold plunge helpful for the pelvic floor or not?
I don't know any research specific to the pelvic floor with cold plunging. I know that there's lots of debate about the benefits of cold plunging for women in particular, and what temperatures and how long. So looking, Dr. Stacy Sims is somebody who, she would be a great guest on your podcast. She's coined the term "women are not small men," and really is trying to highlight how so much research has been done on men, and then let's just back it up a little for women, and not taking into account that we do have different physiology. And cold plunge is one of the things that gets talked about a lot within her community. Like, there's all these benefits, but is it really the same benefit for women as it is for men? And the answer generally is no, especially not as cold, not as long. So nothing's done, not that I know of, nothing's been done specific to the pelvic floor.
Very cool. Very cool. Kim, you're going to come out with a vagina powerlifting competition. I can see it. I just know it's in your future.
There actually is another Kim who does that.
Stop.
Yes. Kim Inami. And she's also from Vancouver, and she is more in the sexual health and wellness space. Yeah, she does. She has people use jade eggs, which is basically like a Kegel weight that's made of stone, a string attached, and then she has incredible photos of herself where attached to the string on that jade egg is a surfboard or a chandelier or anyway. Now, I look at that and I think, impressive, but I also, that's not necessarily the goal. It doesn't, just because you could hold a surfboard, that doesn't mean that's not the gold standard. So again, impressive, but I don't want to put that as like what we are all aspiring to.
We now know what Dr. Spencer is going to be doing for this afternoon. He's going to be doing some research on how to move surfboards with your vagina. I can see it now.
Yes.
Karen's in the next room.
I'm sure she is.
She flew down. I can't wait. Anyway, okay. Kim, we're nearing the end of the show, but we have to do our most fun part of the show, and that is rapid fire questions.
Okay.
You're pretty sharp, so I think you'll do real well, but we do need short answers because we're almost out of time.
Okay.
And that's the point of rapid fire questions, which never happens anyway. All right. Question number 1. How important is your diet when it comes to the pelvic floor? And are there any foods in particular that can cause harm?
Very important. Bladder irritants, harm is a strong word, but bladder irritants could potentially be a challenge. So caffeine, alcohol, artificial sweeteners, spicy foods, acidic foods, chocolate, carbonated beverages, those are very common bladder irritants. So harm is a strong word, but could contribute to symptoms.
Nice. Fascinating answer too. Thank you. Question number 2. What's one guilty pleasure, TV show or podcast you would never admit to binge watching until now?
My binge watch, honestly, is HGTV. I love a good home reno show. I don't watch any of the other ones.
That may be bad enough. That's all right. Oh my gosh. Question number 3. If you weren't a vagina coach, which I love saying that. I can't wait till I get back to work and tell people at the patient, I interviewed a vagina coach today. What's the alternate career that you would have secretly probably had that you would have focused on?
I always grew up wanting to be a dolphin trainer.
Are you serious? Really?
Yeah. I don't know if I would choose that now, but that's what I grew up wanting to be, a dolphin trainer.
Oh my gosh. I actually dated a woman who trained flipper. Do you remember?
Yeah.
You remember flipper? Yeah.
Yeah.
Well, I'm in South Florida, and that was where the Seaquarium was. What a cool. All right, you would have loved that. Question number 4. What's the funniest or most unexpected question someone has ever DM'd you on Instagram or even asked you?
Oh gosh, this is many.
Yeah.
Actually, what I will say, I get lots of people who want to send me pictures of their vagina, who want me to diagnose things. So I've never allowed that to happen, but a couple have tried. One of the funniest things that I will say is I had a woman in my community who is not tech savvy, and my program is delivered online, and we are still in a snail mail because she can't use email, which you have to have an email to sign up for the program, and she successfully did that, but she only communicates via snail mail. So that's one of the funniest stories I have, is I still have her letters posted up on my bulletin board.
The old days.
Betty. Yeah.
Question number 5, and the last question for you, Kim. If you could go back, 20 years to your 20-year self, what would be one piece of life advice that you would, not about work, but about living life? What would that be?
Don't be in a rush to grow up, and make sure that you take care of this vessel that we have along the way.
How many kids do you have?
I have 2 kids, 2 boys.
2 boys? Oh, they must.
Well-educated
early
boys.
training.
Yes.
That's great. I got 2 boys. Dr. Terry has 2 boys. We understand. That's cool.
Yeah.
Kim, thank you so much. What a super informative program. Very unique. Thank you. Thank you.
Thank you for having me. I appreciate it.
Appreciate you.
You too. Thank you.
Thank you for listening to today's episode of the Crackin Backs Podcast. We hope you enjoyed it. Make sure you follow us on Instagram at Crackin Backs Podcast. Catch new episodes every Monday. See you next time.